Hi, my name is Logan Allison. Today I will show you how to properly use a tilt table. A few reasons as why you should consider a patient for a tilt table is if they've been bedridden for an extended period of time, to help decrease osteoporosis, to help improve orthostatic hypotension or pulmonary ventilation. If the patient needs assistance while weight bearing, then the clinician can be free to assist in any exercises or to check vitals. And it can also be used to fit a patient for an ambulatory device. First, make sure the table is at a horizontal. Make sure the wheels on the tilt table are locked in place to assure patient safety. Also, make sure to check the patient's vitals before we start. Check heart rate, blood pressure, and respiratory rate. After checking the patient's vitals and determining they are within normal limits, you're now ready to strap the patient in. Make sure the patient's feet are firm against the foot platform. For standard full assistance, you will use 3 straps. One right below the knee to help the patient maintain knee extension. One over the pelvis to support the lower body, and one over the chest to support the upper body. To apply a strap, first take the strap under the metal bar along the table here. Go under the patient's arms, over the chest, down this other metal bar, then around it. Buckle on the other side. Alright. Ensure patient comfort throughout the process. And make sure the belt is tight enough to secure the patient to the table. The number of straps you use could decrease based on the patient's status. Before raising the table, make sure the patient is comfortable. You can use a towel or a pillow for any areas of discomfort. You are now ready to raise the table. The amount at which you raise the table is solely based on the patient's status. For example, a patient following an acute stroke, it is recommended to raise the table in 10-degree increments. This recommendation could also be used for patients who have been bedridden for an extended period of time. In any instance, while raising the table, you need to communicate with the patient that they inform you if they feel lightheaded or dizzy throughout any of the process. At that point, recheck vitals. If vitals are abnormal, let the patient stay stationary. Recheck vitals. If normal, continue to raise table. If abnormal, lower the table. For this portion of the video, we are going to consider this to be an acute stroke patient. After checking vitals and determining that they are within normal limits, you can now continue to raise the table. Notice that the table is not completely 90 degrees. This is so the patient does not feel a sensation of falling forward. Once the table is raised, recheck patient's vitals and assure patient comfort. You need to assure patient comfort at any new position. You are now ready to resume with any activities that you have for the patient. With patients with single limb injuries, you can place a block under the unaffected side so the affected side is non-weight bearing. Once the activity is complete, you need to recheck the patient's vitals to determine that they are within normal limits. After that, you are now ready to lower the table. Again, while lowering the table, make sure the patient communicates with you if they ever feel dizzy or lightheaded throughout the process. After lowering the table, again you need to check the patient's vitals. If they're abnormal, keep the patient on the table until they return to normal. If they are normal, you are now ready to unstrap the patient. And that is how you properly use a tilt table.